4 warning signs of colon cancer you should never ignore. When someone has colon cancer, how is it typically discovered? It's usually detected with a routine screening test, such as a colonoscopy. It can also be discovered after someone has an emergency medical condition. For example, the tumor can actually cause an intestinal obstruction or a perforation, or it can cause bleeding, and then the diagnosis is revealed after further diagnostic testing in the hospital. And sometimes it's detected when someone has less extreme signs and symptoms. Symptoms of colorectal cancer are typically due to growth of the tumor into the lumen or adjacent structures, and because of this, if someone does have symptoms, it usually, but not always, means that the cancer is fairly advanced. Now, almost 90% of those diagnosed with colorectal cancer under the age of 50 are symptomatic, and the disease is being diagnosed at later stages. And the location of the tumor has a big impact on what symptoms are experienced, starting with the most common symptom, change in bowel habits. This includes diarrhea or constipation, or a change in the consistency of your stool. A change in bowel habits is a more common symptom if the tumor is on the left side. So in other words, your colon goes like this. This is the ascending colon on the right side. This is the transverse colon, and this is the descending colon on the left side. So this would be the right colon and the left colon. Right, left. The second warning sign of colon cancer that you should never ignore would be hematochezia or melena. So hematochezia is the passage of fresh blood through the stool or in the stool, and then melena is the passage of partially digested blood, which makes the stool have a dark, tarry kind of appearance. Hematochezia is more often caused by rectosigmoid tumors, and melena is more likely when the tumor is a right-sided colon cancer, meaning in the ascending colon. The third warning sign that you should never ignore would be abdominal pain and or abdominal distension. Now, abdominal pain can occur with tumors at any site in the colon, and it can be caused by a partial blockage from the tumor, or if that tumor causes a rupture in the wall of the colon, or if that tumor starts to affect the peritoneum, which is the lining that goes over the organs in your abdomen. Now, if the cancer is in the rectum, it can cause rectal pain, diminished caliber of the stool, or tenesmus, which is the feeling that you need to pass stools even though your bowels are already empty. This might involve straining, pain, and cramping. The fourth warning sign you should never ignore would be unexplained iron deficiency anemia. Iron deficiency anemia in colon cancer is a result of unrecognized blood that is lost in the stool, and it's more common with right-sided colorectal cancers. This is why whenever someone has unexplained anemia with low iron, colon cancer needs to be considered as a diagnosis. Tumors in the cecum and the ascending colon are 4 times more likely to cause daily blood loss, which on average turns out to be about 9 milliliters per day. That's compared to tumors at other sites in the colon. A positive fecal occult blood test has a much higher predictive value than any single symptom or combination of symptoms. Now, in that situation, if you have a positive fecal occult blood test, the next step would be to have a colonoscopy for diagnosis. 20% of patients with colorectal cancer present with metastatic disease, with the most common sites being lymph nodes, liver, lungs, and peritoneum. Age is a major risk factor for sporadic colorectal cancer. In fact, the incidence begins to increase significantly between the ages of 40 and 50 and continues to rise as we age. And we're seeing colon cancer becoming more and more prevalent at younger ages. And this seems to strongly correlate with certain lifestyle risk factors like tobacco use, alcohol use, and the food that we eat or don't eat. For example, known colon cancer risk factors include insulin resistance, type 2 diabetes, and obesity. The common thread there that these things are all caused by eating too much processed food, especially excess sugar, with subsequent increased insulin levels in the blood. Now, sugar supplies the backbone for the structural elements that allow the cancer cell to divide and multiply, namely lipids, the ribose molecule of DNA, and amino acids. Insulin is an important growth factor for colonic mucosal cells and actually stimulates the colonic tumor cells. Blood levels of insulin-like growth factor 1, or IGF-1, as well as IGF binding protein 3, were reported to have increased risk of colorectal cancer in a cohort of almost 15,000 males. Also, long-term consumption of red meat and/or processed meats seems to be strongly correlated with an increased risk of colorectal cancer, particularly for left-sided tumors, mainly because processed meats are laden with nitrates. High temperature cooking, like with barbecuing or pan frying, is likely to be contributing to this risk, which may be due to the production of polyaromatic hydrocarbons, PAH, as well as other carcinogens produced from the proteins in this charring process. Now, it's estimated that for every 50 grams of processed meat consumed per day, the risk of colorectal cancer rises by about 16%. For every 100 grams of red meat consumed per day, the risk goes up by about 12%. But let's focus on processed meats. So nitrates and nitrites are the preservatives in cured meats like bacon, salami, sausages, pepperoni, and hot dogs. They prolong a food's shelf life and give it an attractive hue, but here's the problem. Nitrates turn into nitrites, which then react with amino acids to form nitrosamines, which then react with nitrogen to form nitrosoureas. Now, these are among the most potent carcinogens in existence and are associated with virtually every cancer of the GI tract, not just the colon. In fact, nitrates and nitrites are classified as group 1 carcinogens, placing these foods in the same risk category for cancer as cigarettes, alcohol, and even asbestos. So even though there are some risk factors for colon cancer that are out of your control, like genetics and age, there are some that are in your control. And that mainly entails avoiding things like tobacco, alcohol, and making sure that you're eating mostly unprocessed food, which naturally has the fiber you need and keeps your insulin levels low because it doesn't have that added sugar. And if you enjoyed this video, you're probably gonna wanna check out this one right here.